Welcome back. It's Thursday, and that means a virtual house call from the good doctor. KRDO News Channel 13's Dr. John Torres.
Yeah, our Thursday just got better. Dr.
It
John
sure did.
joins us via Skype today. How's it going, Dr. John?
It's going great. How are you guys doing today? I'm doing a lot of thinking right now.
We liked your
we
pensive,
saw that. Yeah.
pensive face.
We're going to make a statue of you so you can put it out in front of your clinic of you thinking. But we'll talk about that another day. More and more mosquitoes are showing up with West Nile in our state. What are the symptoms, Dr. John, and what's the treatment for it?
And you're right, with all the wetness we've had, we're seeing tons of mosquitoes. The good news is that most of us who end up getting infected with West Nile aren't going to develop any symptoms at all. As a matter of fact, less than 1% will develop a serious neurological illness, but unfortunately that illness could be permanent in some. Around 1 in 5 people who do get infected are going to develop a fever, a headache, body aches, joint pains. They might get vomiting and diarrhea or even a rash. If you think about it, these are normal symptoms with a lot of different things. But most people with this type of West Nile virus disease end up recovering completely. But fatigue and weakness can last for weeks or months, and like we said, some can have permanent neurological issues. Right now, there's no vaccine or specific treatment for West Nile. Over-the-counter pain relievers can be used to reduce the fever and relieve some of the symptoms. But the main thing is to avoid what you can, to do what you can to avoid mosquitoes at all costs. Wear repellent, make sure your screens are in good order and good repair so that way they don't come inside the house, and avoid those times of day when they're outside.
And Dr. John, I think we've talked about this before. Some people seem to get bit more than others do. What factors into that? And we're hearing that fat might have something to do with it?
It could be, and it's kind of a genetic luck of the draw. Sometimes more people are just susceptible to insect bites and they get bit a lot more than other people. One thing we found out over the last couple of days actually is there's 3 things mosquitoes go for. Carbon dioxide, that's the stuff we basically breathe out of our lungs. They go for heat, so they sense the heat on our skin, and then they go for dark colors. So blue, they love blue. Yellow does not attract them. So just a little tip that hopefully can get you so you're not getting bit quite as much.
So blue,
Interesting.
You should avoid, and yellow is something you should wear if you're going to be outside at night, maybe if you're even camping or something like that.
Exactly. If you think about it, the insect lights that attract insects and zap them, they're blue. So that's attracting the insects, so don't wear that color.
All
Interesting.
right. That is very interesting. Great tip for all of us. A new study shows that we should all know CPR, but why is this study coming out now, Dr. John?
Well, it's coming out now because of a new study they just did, finding out just how important it is and how easy it is to learn and how beneficial it is to people that are having problems right there. As a matter of fact, researchers at Duke University ended up finding out that people performing CPR do a great job at saving lives, and so that's the most important thing we can talk about. This study also taught people to use automated external defibrillators to deliver shocks and to restore normal heart rhythms. They found over the next 3 years, rates of bystanders performing CPR, these are non-medical people performing CPR, rose significantly. They also found that those suffering cardiac arrest were twice as likely to survive and leave the hospital without severe disability if a bystander had performed CPR and delivered shocks before the medical help arrived. But one thing, even the best CPR can't save all the lives every time, but the chances of surviving a cardiac arrest outside of a hospital, even though they remain low, are much improved if a bystander can intervene and start that right away. But the study does show, again, that non-medical personnel can make a huge difference, so get trained. Are you guys trained?
Sadly, I am not.
You know, I was certified many moons ago, but I think it's also a reminder that you need to, stay up to date on that training and know how to do it, because when the time comes that you need it, you don't have another chance.
And we'll talk more when I'm in there on Monday and see if we can get you trained.
All right.
Thanks,
Thank you, Dr.
Dr.
John. You have a good
bet.
weekend, and we'll see you
You
on
too.
Monday.
All right.
We'll be right back.